Are you ready to go, Yinka? Here she is.
Yes. Good morning, everyone. My name is Yinka. The title of my presentation today is how, bear with me, just bear with me, please.
That's
I
fine.
just
You
need
take
to make my,
your
I need
time.
to make my screen bigger. Oh, sugar, I don't know how to do this. Oh dear.
Take
I'm
your
just
time,
trying to
Yinka.
get,
That's
I'm trying
fine.
to get rid of the charts on the side so I can make my screen bigger because I'm not able to see the text. I'm seeing your image, Gemma, but anyway, it doesn't matter. I'll
So
try and,
perhaps if you go off speaker view, Yinka, that might do it.
oh, really? Sugar. Speak of you? Oh dear. I don't know.
Top right-hand corner.
Okay. No, it's just made it smaller.
Oh, okay. Well, that's my
Anyway,
technological knowledge.
that's okay. I'll just carry on. I'll just carry on. Oh yeah, okay. I think I've managed to do it now. Anyway, the title of my presentation is Health Visitors' Perceptions about Offering Support to Bereaved Parents. Can you go to the next slide, please? So my category of bereaved parents include stillbirth, neonatal death, and sudden unexpected death in infancy. So stillbirth is when a baby dies before or during birth. That's provided baby is 24 weeks gestation or more. Neonatal death, obviously, is when the baby dies within 28 days of birth. And sudden unexpected death in infancy is when a baby or toddler under 1 year dies unexpectedly. But however, because health visiting covers ages 0 to 5, so this covers children under 5. Yeah, next slide, please. So the background to this project is that I was, as a newly qualified health visitor, I was asked to go. I think I was 6 months or so after qualification. And then one of my clients lost his baby girl. And I was asked to go and offer support to this client. And I didn't know what to do. At first I refused to go. And my team leader, yeah, she was quite understanding, but then said to me that, look, you're the only one who has seen this family and you have to go. And the reason why I didn't want to go is I felt like I wasn't prepared at all to offer this sort of support. There was no training at all in during my health visiting training, and even as a newly qualified, there wasn't any training. There are other trainings like CPR, resuscitation, manual handling, which through my years in health visiting, I've never had to use. But then I asked around, and quite a number of the older health visitors had to support bereaved parents. So and I did ask them, and a lot of them said that that they managed this just by maybe going onto Google, by asking each other for advice on what to say, and I even inquired of other health visitors outside my trust, and it's the same thing as well. None of them really had any formal training as to how to support bereaved parents. Next slide, please. And then, so this is the statistics on infant mortality. So while one can say that, infant mortality is low in the UK, there are still statistics that show that babies do die for whatever reasons, one reasons or the other. So infant mortality rate is the number of children that die under 1 year of age in a given year per 1,000 live births. The neonatal mortality rate is the number of children that die under 28 days of age in a given year per 1,000 live births. So these are both common measures of healthcare quality, but they are also influenced by social, economic, and environmental factors. Next slide, please. And we can see from this slide that, this is only a comparison between countries in the UK, England, Wales, Scotland, and Northern Ireland. So compared to the 1990s, infant mortality rate has come down significantly, but then it's still not where we want it to be. We can see that, England is the one in green. England and Northern Ireland are still a bit high in comparison with Wales and Scotland. But ideally, we want it lower than that. So it shows that it's still a problem. Babies are still dying. Next slide, please. And this is an international comparison. I've only done 3 countries, and we can see that US is quite high. UK as well is quite high as well in comparison to Japan. And I wasn't able to bring in other countries, but it's quite significant where the UK is. So so children are still dying, and there would always be reasons for health visitors to go and support bereaved parents, and the training is lacking. Next slide, please. So I did a search of the literature, and the literature actually showed that there is paucity of up-to-date research into health visitors' role in bereavement care. It's almost non-existent, actually. A lot of bereavement care talks about hospital bereavement care, and there was even a new national bereavement care pathway. And this also is just vaguely spoke about the role of health visitors and GPs without actually specifying anything. Most of what I found had to do with hospital nurses. But nevertheless, next slide, please. And nevertheless, I thought, okay, let's see how the hospital nurses cope. And I found that even amongst hospital nurses, the problem is lack of training, which results in grief amongst the nurses. The nurses feel guilty when they support bereaved parents. They feel like they haven't done enough. They suffer from burnout. They suffer from compassion fatigue, and that's having to support bereaved parents over and over again, and not really having any answer or any way of comforting them. That will result in compassion fatigue. And there was also difficulty working with fathers, and of course, lack of standards. Next slide, please. So I decided to carry out a primary research in my trust, and I collected data through 2 focus group meetings and 4 one-to-one interviews. And the discussions were audio recorded, and thematic analysis was adopted for evaluating the data. Next slide, please. And the results of the research showed, similar to hospital nurses, it showed that health visitors found bereavement care challenging due to lack of standards to guide practice, lack of training in bereavement care, lack of support from colleagues in form of supervision and debriefing. And the health visitors also expressed concerns about not knowing the remit of health visiting when children under 5 are no longer present in the household. And this means that if say a health visitor was supporting a mother of, say, perhaps a child of 6 year of age, and the mother has a baby, and the baby passes away. So what do we do? Do we just dump the mother and say, oh well, the baby has now passed away, I don't see you anymore, you don't have a child under 5? So these are real issues, real life issues that no one really has an answer to. Next slide, please. So anyway, I discussed the result of my research with my team leader and some other senior members of staff. I didn't really get any major encouragement from the senior staff members. There was a lot of push for something to be done, and then at some point I got invited to a development group, a health visiting development group. I went for the meeting. Unfortunately, I think I must have been the only health visitor present, and a few school nurses, which was very sad. And then I was told that I'll be able to come and present my findings at the next development meeting. I sent the whole thing to the director of children's services, and then COVID-19 happened, and everything just kind of went to the background. But then I thought the only way to get this going is to publish. So I made a decision to publish my paper, which I did. Next slide, please. I published it in the Community Practitioners, the July 2020 edition. And I have since then, fortunately or unfortunately, I have since then moved from health visiting. I'm now working as a discharge matron with Berkshire Healthcare Foundation Trust. But then when I realized that I was going to do this presentation, I wrote to my team leader in my previous trust while I was a health visitor, just to find out how my intervention went, because now that it was published, they were aware that it was published, and I just wanted to know if something had come out of the publication. And this was the report I got back, which says, I think your intervention has helped a lot and really highlighted a gap in the service. It has helped to bring the CONI service. CONI is the care of the next infant, the CONI service over to the health visiting team. And I'm supposed to be working with someone else to make a teaching session about CONI and bereavement. I'm looking forward to getting staff trained up. SANS training is excellent, and I have got some SANS pack now to pass to parents. Definitely, you have made a positive impact on addressing bereavement. So I think what happened is somebody subsequent to the publication, one of the staff, one of the health visitors was then sent on to a bereavement training run by SANS. And the intention is for her to train up other health visitors on how to support bereaved parents. Next slide, please. And these are my references.
Fantastic. Thank you so much, Yinka. Now, I saw some of your colleagues in your group watching with intention there and nodding to everything they heard. I wonder, Lillian, would you like to comment on what you heard there from Yinka?
Hi, sorry. Yeah, thank you very much, Gemma, and thank you, Yinka, for such a fantastic and very well coordinated piece of work. And I think, you know, sometimes we do the work we do without actually taking time to try and also look at the evidence behind whatever we're doing. And I think to see you go through, you know, the literature and establish the figures and then use that to inform your piece of work is very, very inspiring. So thank you very much. I don't have much to say, but
that's perfect, Lillian.
Yeah,
Lillian, absolutely perfect. I completely
Thank you.
agree. Lillian, it was about using the evidence and then contributing to the evidence by disseminating your own work and being able to see the impact of getting that out into a published piece is a real inspiration to all of us on the group. Yinka, thank you so much. Tenacity, perseverance, resilience, all those things that Yvonne spoke about in her opening.
Thank you.
Thank
And
you.
if anyone wants to access the published work, it's online actually. It's just what are the perspectives of health visitors in offering support to bereaved parents. If you type that on Google, it should come up.
Fantastic. Thank you. Thank you so much, Yinka.